Autoregulation plays an important role in maintaining glomerular filtration rate during episodes of decreased effective arterial volumes, also referred to as EABV, resulting in decreased renal perfusion pressures. Under normal physiologic circumstances, during times of decreased perfusion pressures, vasodilatation of the afferent arteriole and vasoconstriction of the efferent arteriole maintains normal glomerular capillary pressure, thereby preserving GFR. We discuss autoregulation in depth in earlier modules. As a brief overview, arterial diameter is mediated through several mechanisms, which include 1. Myogenic stress response, 2. Tubuloglomerular feedback, and 3. Sympathetic stimuli. Efferent vasoconstriction is largely mediated by angiotensin II activity through the renin angiotensin aldosterone system. There are various scenarios by which autoregulation is impaired, some related to disease states, others iatrogenic. Here we will discuss the impact of renin angiotensin aldosterone system inhibitors, which we will refer to as RAAS inhibitors, and nonsteroidal anti-inflammatories, which we will refer to as NSAIDs, and we'll take a look at how they impact renal autoregulation in states of low renal perfusion pressures. In general, RAAS inhibitors like angiotensin-converting enzyme inhibitors, ACEs, and angiotensin receptor blockers, ARBs, and NSAIDs like ibuprofen and naproxen impair the autoregulatory response to low EABV and low renal perfusion pressures. This results in a net decrease in glomerular capillary pressures and GFR. RAAS inhibition ordinarily blocks activity of angiotensin II. Angiotensin II preferentially vasoconstricts the efferent arteriole in low perfusion pressure states, thereby working to maintain GFR. Impairing this vasoconstrictive mechanism results in reduction in glomerular capillary pressures and a low GFR. NSAIDs inhibit prostaglandins. Ordinarily, prostaglandins are one of the mechanisms contributing to afferent arterial vasodilatation in low perfusion states, thereby opposing sympathetic vasoconstrictive stimuli. However, blocking prostaglandins during a low EABV state impairs vasodilatory properties of prostaglandins, resulting in glomerular capillary pressures dropping below normal values and decreased GFR. The combination of RAAS inhibitors and NSAIDs in a low renal perfusion state results in impairment of both the afferent and efferent arteriolar autoregulatory response. The result is glomerular capillary pressures dropping and a decreased GFR. It is this combination that, in the right setting, can contribute to acute kidney injury and even ischemic tubular injury, also known as ATI or ATN.